which approximately 1,000 certified ombudsmen who have a regular presence in approximately 1,300 skilled nursing facilities and almost 7,600 residential care facilities for the elderly. Prior to his appointment as State Long-Term Care Ombudsman, Professor Rodrigues was the Assistant Director at the Alameda County Area Agency on Aging. Before working for the County of Alameda, Professor Rodrigues was the Executive Director of St. Peter's Community Adult Daycare Center. And this is the first licensed adult day support center in the county. Professor Rodrigues is on the faculty gerontology program of the California State University of Sacramento. Professor Rodrigues is the immediate past president of the National Association of State Long-Term Care Ombudsman Program and is on the board of directors of the National Committee for the Prevention of Elder Abuse, the California Council on Gerontology and Geriatrics, and the California Culture Change Coalition. He is also a member of the American Society on Aging and Sigma Phi Omega, the National Academic Honors and Professional Society in Gerontology. Professor Rodrigues earned a Bachelor's of Arts degree in Philosophy from St. Patrick's College in Mountain View, California, and a Master's of Divinity degree from the Graduate School in Menlo Park, California. He also holds a lifetime instructor credential from the California Community College System. And everyone, please join me on welcoming our guest speaker today, Professor Rodrigues.
Thank you. Nice to see a lot of familiar faces today. Thank you for the invitation to come speak to you about the Long-Term Care Ombudsman Program and career opportunities with the state of California. So if you've been in any of my classes in the past, you probably know already that I'm the California State Long-Term Care Ombudsman. But we haven't really talked a lot in class about what the Ombudsman Program does and its history. So that's what we're going to do today. Okay. So today we'll be talking about the advocacy work of the Long-Term Care Ombudsman Program and the results that we've been able to accomplish on behalf of residents in long-term care facilities here in the state. Today we're going to talk about the history and role of the Long-Term Care Ombudsman Program. We're going to talk about the 6 core elements of the California Long-Term Care Ombudsman Program, and then we'll talk about the results achieved by long-term care ombudsman advocacy. Our mission statement is simply the following. We're here to advocate for the dignity, quality of life, and quality of care for all residents in long-term care facilities. And when I say long-term care facilities, we mean primarily skilled nursing facilities and residential care facilities for the elderly, sometimes called assisted living facilities, sometimes called boarding care facilities. The Long-Term Care Ombudsman Program was created in the mid-1970s by the federal government to advocate for the rights and needs of long-term care residents. And the program initially started as a pilot program that was developed by Dr. Arthur Fleming. Dr. Fleming was, back in the Eisenhower administration in the 1950s, the Secretary of Health, Education, and Welfare. And also in the 60s was the Commissioner on Civil Rights for the federal government. Later, in the early 1970s, Dr. Fleming became Special Advisor to President Nixon on aging issues. Also in the early 1970s, the news media began to run stories about the problems that we were seeing in nursing homes. Now, if you remember from Gero 102, in 1965, Congress created Medicaid, which for the first time created a federal source of funding for nursing homes. Up until that point, nursing homes were basically a private paid proposition or a charity run by the state, by the county, religious organizations. So 1965, Medicaid pays for long-term care, in particular skilled nursing care. And we see tremendous amount of growth in the development of skilled nursing facilities throughout the country. People began to realize there's money that can be made here. Well, there's funding for these programs, but little federal oversight and regulation of these facilities. So we start hearing about in the media horrible stories. Stories about fires, stories about unsprinkled buildings, stories about people being physically restrained in their beds or in wheelchairs, people crying out for help. You walk into a facility and the first thing that hits you, literally, is the smell of urine. These were not very pleasant places to live in or to work in. Not only did the media get people's attention on the situation in nursing homes, but also consumer advocates like Ralph Nader began to take notice of the problems of nursing home residents. There were congressional hearings that were had in order to look at the problems in skilled nursing facilities and what are some of the solutions to some of these problems. Dr. Fleming, as that special counsel of President Nixon, identified for the president a 7-point plan. Actually, it was a 6-point plan on how to deal with improving regulation and oversight of nursing homes. At the last minute, Dr. Fleming added a 7th point to the plan. That plan was the Long-Term Care Ombudsman program. Dr. Fleming envisioned a program based on the Swedish or Scandinavian model of an ombudsman. An ombudsman literally means a representative of the government who listens to the complaint or complaints of its people. So Dr. Fleming envisioned a government-sponsored program that would solicit volunteers based in the community who would go into these nursing homes in their neighborhoods, in their communities, to assess the conditions in which residents were living, to advocate for these residents when they had problems or concerns, and to make sure that their problems were solved. So in the mid-1970s, there were 5 or 6 pilot ombudsman programs in different states that looked at various models of providing the program and made recommendations to the federal government on what the program should look like. These models proved to be very successful in resolving problems for residents at the lowest level possible in the facility, bringing these problems to the attention of appropriate staff within the facility who could then take action and fix the problem for the resident. What were some of these problems like? Well, in the early days, lots of complaints about food. Food not being appetizing, food not being nutritious, food being served cold, food that people didn't like or that wasn't palatable. Lots of complaints about theft, lost clothing, lost laundry. Relatively easy complaints to address. Today, the complaints we see are a lot different than just bad food and lost laundry. We'll talk more about those complaints a little bit later. But these programs proved very effective in resolving the problems that residents experienced. And so Congress, when it reauthorized the Older Americans Act in 1978, decided to make this program a mandated program of the Act and required all states to establish an office of the State Long-Term Care Ombudsman. Here in California, that office was established here in 1982, and we're housed at the California Department of Aging. We work with the local area agencies on aging to assure that there's an ombudsman program in each of the planning and service areas of the state so that all nursing homes, all residential care facilities for the elderly are covered. Our core mandate that's in the Older Americans Act is to identify, investigate, and resolve complaints that are made by or on behalf of residents that affect their health, safety, welfare, or rights. So we have a very broad mandate. We don't just sit in the office and wait for the phone to ring. We don't wait for people to make complaints to us. Part of our job is to go out to facilities and observe the conditions of residents in these facilities and to identify problems. So if we're in a facility and we see that perhaps the carpet over here seems to be coming up, and this could present a fall risk for a resident walking down the hall, we might point that out to facility administration and suggest that they get that fixed before somebody hurts themselves. If we see clutter in a hallway, if you ever go to a nursing home or assisted living facility, you'll notice something right about here on the wall. What is it? Railings. Yes, handrails. So if a hallway is cluttered with equipment or mops or carts, that makes it difficult for residents to hold on to the handrail to ambulate down the hall. Those hallways are supposed to be clear and not storage areas. Again, something we might point out and remind facility staff about. We might see soiled laundry on the floor. We might see spills. We might see other hazards in the facility that people aren't paying attention to, that we bring to their attention on behalf of residents. So today, in 2015, because of the requirement of the Older Americans Act, every state in the union has an office of the State Long-Term Care Ombudsman. We also have offices in the District of Columbia, Puerto Rico, and Guam. So, even though we're established in federal law, there are also state laws that establish the program. And every state also has state, what we call enabling statutes that provide for the operation of the program. Many states have structured their programs differently from their neighboring states and have added additional responsibilities to the work of the local ombudsman program. So what do we do here in California? Well, first of all, our primary function, again, is to identify, investigate, and resolve complaints. We also do the following things. We monitor, analyze, and comment on legislation, policies, practices that affect residents. So in addition to doing our individual complaint resolution work, we also look at the broader long-term care system and legislation, laws, policies that affect residents in long-term care facilities. So each year, as bills are introduced by the legislature, we look at those bills, we analyze them to determine, are these bills going to be helpful to residents, or are they going to be harmful to residents? If we have concerns about provisions in the bill, we contact the author's office, the legislator's office, and offer suggestions to the author on how to improve this legislation. If we see a bill that we really like, that we think would be helpful to residents, we again let the author's office know that we're going to support this bill in hearings throughout the year. We engage in systems advocacy to affect change. What does that mean? Well, when we see a problem with the long-term care system, in addition to monitoring and analyzing bills or policies that come across our desk, we also work with other stakeholders to improve the long-term care system. So we work closely with the Department of Public Health that licenses the skilled nursing facilities. We work closely with the Department of Social Services that licenses the assisted living and boarding care homes. We work with the Bureau of Medi-Cal Fraud and Elder Abuse in the Attorney General's office. We work with the professional associations for both the for-profit and the non-profit nursing homes. And other citizen advocates, like California Advocates for Nursing Home Reform. That's really a non-governmental agency. It's an agency that doesn't receive public funding, but has as the core of its mission improving quality of care in long-term care facilities. So we partner with organizations like Canner to help bring attention to the issues that residents face and to work out solutions for residents. As the state ombudsman, I designate local entities throughout the state to be representatives of the Office of the State Long-Term Care Ombudsman. This is kind of an interesting structure. We contract, since we're housed at the California Department of Aging, we use their contracting process to contract with the area agencies on aging that provide Older Americans Act services. The area agencies decide locally whether or not to provide a service as a direct service of the area agency or to contract it out with a nonprofit agency in their community. So when an area agency wants to choose a nonprofit agency or wants to provide the program themselves, that entity has to be designated by the state ombudsman to be an official representative of the office. So they're not employees of the state, but they are representatives of the office. And that becomes important because these individuals, in the good performance of their work, or in the faithful performance of their work, they may get sued, they may be party to legal action by a facility or a family. Because they're a representative of my office, we guarantee them legal protection. And so all representatives of the office are represented by the Attorney General of the state of California. We provide background clearances and certification of ombudsman representatives. Anyone who becomes an ombudsman representative here in California has to go through 36 hours of training, followed by an internship and a criminal background clearance. They have to be cleared by both the California Department of Justice and the FBI. Once that clearance is made and there's no other conflict of interest that would prohibit them from being a representative of the office, I then certify that person as someone who's a representative of the program. The state office here in Sacramento develops policies and procedures that the local programs have to follow. We develop a curriculum that's used for that 36 hours of training that's provided locally and online. We provide technical assistance to our local offices when they come across a situation that doesn't neatly fall into a policy or procedure or a regulation. There may be gray areas of the law. We do the research and help them work their way through that problem with the resident. We also monitor each of our 35 programs on a regular basis to ensure that they're in compliance with both state and federal laws and regulations. And we also operate a 24-hour, 7-day-a-week crisis line for residents of long-term care facilities. During regular business hours, that crisis line is staffed by operators in my office. At night and on weekends, it goes to an answering service that triages the calls and then, if necessary, contacts the local ombudsman programs for intervention. One of our responsibilities, of course, is obviously elder abuse prevention. And we do that in a variety of ways. We provide information and consultation to residents and facilities about residents' rights, about elder abuse, about mandated reporting of elder abuse. We promote the development of citizen organizations who are interested in long-term care and want to improve the long-term care system. Citizen organizations are groups like the one I mentioned earlier, California Advocates for Nursing Reform, or CANR. We work very closely with them. We provide technical support to resident and family councils in long-term care facilities. Sometimes it's difficult for residents or families to get these councils started in buildings, and so we can provide some support to those groups so that they get a firm foundation upon which they can build a fruitful and productive resident or family council that's empowered to advocate for themselves and for their family members. We recommend changes in laws, regulations, and policies that benefit residents. Again, that's part of that analysis of the legislation that we do. We provide training to facility staff on a variety of subjects: residents' rights, abuse reporting, alternatives to antipsychotic medications for people who have dementia. We also provide community education sessions to groups in communities back home that may be interested in what's going on in skilled nursing facilities or residential care. This presentation today will be an example of the kinds of community education events that we participate in. In addition to prevention, there's also intervention. State law guarantees, and as well as federal law guarantees, that facilities must provide access to an ombudsman if a resident wants to see one. So we're able to go into facilities 24 hours a day, 7 days a week. Facilities are not allowed to hamper or to interfere with an ombudsman's access in the facility. If there's willful interference with our duties, the facility can be cited with a civil penalty of up to $2,500 per incident. We've already talked about the complaint investigation. We also see legal and other remedies to protect residents. The #1 complaint the program sees nationally is unlawful discharge or eviction from a facility. Oftentimes, if you're a resident that requires a lot of care, if you're a difficult resident, if you're a very vocal resident, sometimes facilities will look for ways to evict you from the facility so they don't have to deal with you. So if you've got, a condition that needs to be treated suddenly at the acute care hospital, and you're treated and you're okay and it's time to go back home now, the facility may refuse to readmit this resident, saying they can no longer provide care for this person anymore. Well, what's changed? You were able to care for this person 3 days ago. What's changed in 3 days that you can't take care of this person now? So we'll help residents appeal that determination and help them fight that in an appeals hearing. We also, in addition to speaking out on behalf of residents in legislative hearings, we're also trying to facilitate public comment on these same issues. So working with our partner organizations, working with citizen advocacy groups, we'll ask people to write letters to legislators. We'll ask residents, to the extent that they can, or resident councils, to write letters, to show up if possible at hearings, to speak out on these issues that affect them. There are some California-specific requirements for the program that the legislature has given to us. These aren't necessarily requirements in other states, but they are here in California. The first one is that state law treats us as mandated reporters of abuse and neglect. So when we have the consent of the resident or the resident's representative, we're supposed to cross-report instances of physical, mental, emotional, sexual, financial abuse of a resident of a long-term care facility. And we would cross-report that to licensing, to law enforcement, to the Bureau of Medical Fraud or elder abuse. We are also, along with local law enforcement, are one of the agencies that receives and investigates reports of suspected abuse of elders or dependent adults that occur in long-term care facilities. Those make up about 17% of all the complaints we see statewide. And we handle about 40,000 complaints a year. So roughly we're talking about 6,000, 6,500 complaints of abuse every year. We also have a requirement to witness advanced health care directives for residents of skilled nursing facilities and property transfers for residents of skilled nursing facilities. So if a resident in a SNF wants to donate a piano, a television, if they want to sell a car to a CNA or a nurse that's employed by the facility, that transaction has to be witnessed by the ombudsman so that we can assure that the resident isn't being coerced into making that transaction. So, because every state operates their ombudsman program a little bit differently depending on what other responsibilities the state has given to them, we thought here in California it would be good to establish clear directions for our local programs about what activities they need to be involved in at their level. So we identified 6 core elements, 6 core functions of the program that you should see in any ombudsman program in any part of California. And we'll talk about each one of these in a little bit more detail. First and foremost, identify, investigate, and resolve complaints, ensure a regular presence in long-term care facilities, address patterns of facility practice, maximize community awareness and involvement, influence public policy, and ensure effective program administration. The objectives behind establishing these core elements were to improve the consistency of long-term care ombudsman services statewide, to provide a basis on which we could develop standards, performance indicators, and other tools to help both the state and local programs manage the effectiveness of their services. So some quality assurance, quality improvement activities. And to make sure that the direction of the state office here in Sacramento and that of the local programs are running along parallel lines, that we're working together. So the first core element, identify, investigate, and resolve complaints. How do we do that? Well, there can be intake of resident concerns in person and by telephone, by the resident himself or herself, a family member or a friend of the resident. We take complaints even from facility staff oftentimes about a problem that a resident is experiencing. We do an investigation and documentation of the complaint and the resident issues. We gather the facts through interviews, through records review, through talking to the resident, talking to others who might know more about the problem or might also be experiencing the problem. And our goal is to resolve the problem. In California, we're able to resolve about 76% of all complaints that come into us. So a little more than 3 out of every 4 complaints we're able to resolve to the satisfaction of the resident. And that's our performance indicator, whether or not we are able to resolve the complaint to the satisfaction of the resident. Not to my satisfaction or to the ombudsman representative's satisfaction, but to the satisfaction of the resident. To the resident's perspective, is this problem resolved? Of course, we also investigate allegations of abuse, and those are a little harder to resolve because once someone has experienced abuse, what does it take for that resident to feel that that problem is resolved? If the perpetrator has been terminated or arrested and the resident is now safe, that might be sufficient for that individual to feel that problem is resolved. For some people, there could be more lasting effects of abuse. It might take longer for that problem to be resolved. Psychologically, emotionally, or even financially. Oftentimes, we'll also get complaints from family members about care that the facility is providing that perhaps is inadequate, or the resident has developed something that isn't being considered by that resident's care plan. So we might ask the facility to call a care plan meeting with the resident's family, and ourselves, so that we can advocate for the resident and whatever new condition this resident is experiencing. As I said, ombudsmen just don't sit back in their offices and wait for complaints to come into them. We endeavor to go out to facilities at least once a quarter, not in response to a complaint. Just to go out, an unannounced visit, check on the condition and status of residents, monitor the conditions of facilities, identify new residents who have moved into the facility, make sure they understand their rights as a resident of that facility, try and determine if that resident is experiencing any problems. We try and establish relationships of trust with residents, because you have to understand these residents are very vulnerable. They're dependent upon their caregivers for almost every facet of their lives. And many people are very reluctant to confide in us. One provision of the Older Americans Act that speaks to this is the provision around ombudsman confidentiality. A few moments ago, when we were talking about being mandated reporters of abuse or neglect, I said we could only cross-report and disclose a resident's identity when we had the consent of that resident or the resident's representative. That's because the Older Americans Act says we can only disclose information when a resident tells us it's okay. Recognizing that many residents don't want their names out there, many residents are fearful of action that the facility can take against them, throw them out, evict them, change the way they're providing care. So we may have knowledge about a problem that a resident has brought to us, but they may not want us to take action on it for fear of retaliation. And so we talk to a resident and try to explain to a resident that we really can't do everything we could do for that resident in trying to resolve their problem if we can't disclose their identity for cross-reporting. Many times they tell us no, but sometimes they tell us yes. If a resident says, no, I don't want you to disclose my name, I don't want you to say anything, that doesn't mean we just walk away from that resident. We continue to follow up with that resident to make sure they're safe, to see if there's been any change in the status of the problem, or to see if other residents in that community are experiencing that problem, and if one of those residents is willing to allow us to disclose right now. If it's such a grave problem that we see the potential for it affecting many residents in the facility, the ombudsman can initiate what we call a group complaint on behalf of all the residents in the facility. That way, you're not singling one particular resident out for identification by the facility staff. So, in addition to the regular visitation and checking in with residents, we also are there to witness advance healthcare directives, property transfers. We participate in resident and family council meetings, answer questions, provide information to the councils, and then we also track facility trends. You know, if we see certain trends around staff not calling in, if we see a growing number of complaints about food or other issues in the facility, no activities, or the activities that they say are going to happen don't happen. We can monitor those things on an ongoing basis and bring those to the attention of the facility administration and say, look, you've got a problem here. We've noted over the last 3 months, this problem with your menu, this problem with activities, you've been short on staff, 4 out of 7 days during the week. People have waited for 30 minutes to 40 minutes for assistance to go to the bathroom. That's just not acceptable. We can do analyses of facility practices because we keep track of all the complaints we receive, not just the number, but the type. We track about 117 different types of complaints about quality of care, quality of life in the facility. And we can use those to bring problems to the attention of the administrator. So let's say last year at Shady Pines Nursing Home, we had 12 complaints. And 9 of those complaints were around residents' rights. Residents being treated with dignity and respect. Poor staff attitudes around residents. We can go to that administrator and say, hey, these are all the complaints we had last year. Why so many around residents' rights and being treated with respect and dignity? Would you allow us to do an in-service for facility staff on respect and dignity and residents' rights? So we can take that complaint data and try and use that to do some proactive training of staff to help mitigate some of the problems that residents are experiencing. Again, we coordinate with other local and state agencies when we see problems in facilities that really are beyond our control. Ombudsmen are advocates. We're not regulators. We don't have the ability to enforce laws or regulations. That belongs to the Department of Public Health and the Department of Social Services. But we can certainly bring our knowledge of problems to those agencies so that the regulatory agencies can come in and help the facility correct their deficient practices. We maximize community awareness and involvement in facilities by providing information and consultations to individuals, to the general public, on long-term care issues and trends. Many of the calls we get on our crisis line aren't necessarily a crisis, but have the potential for becoming one. We can get a call on a Friday afternoon at 4:30 from a very concerned son or daughter whose mom is in the hospital, who's being discharged, and they want to discharge her to a nursing home that the son or daughter knows nothing about. We can provide information to that relative about that nursing home, some of the issues that we've seen in providing care at that nursing home, and maybe some other options for that person to consider, so that they're not not being forced into making a quick decision without having information available to them. We also do educational presentations in the community for families, for other service organizations and clubs that have an interest in long-term care. We also, from time to time, as we get the money to do it, do media campaigns on community awareness and long-term care and try and get more people involved in the program. We have about 1,000 ombudsman representatives throughout the state, and about 860 of those representatives are volunteers. So we have very few paid staff, about 130, 140 paid staff. Most of our representatives are volunteers, and we get many of those volunteers through the presentations we make to community groups. We've already talked about our role in systems advocacy and monitoring and speaking out on bills that affect residents. So we track and comment on proposed changes in both state and federal laws and regulations that affect our program and the residents we serve. We write letters to legislators, senators, assembly members, members of Congress, governor, the president, around federal or state policies that affect residents, and encourage them to either veto or to sign legislation depending on how they affect residents. We coordinate some of these activities with other state agencies to gain their perspective on some of these bills. Sometimes we'll be in agreement, sometimes we'll be in disagreement. And at the end of the day, it's whoever can make the best case with the governor's office and convince him whether or not to sign or to veto a bill. I can think of one particular example a couple of years ago where there was a real controversial bill that was introduced in the Assembly. Right now, basically in California, you can't smoke anywhere, right? You can't smoke in restaurants, you can't smoke in parks, even here on campus, there are certain places where you can't smoke, you're within 20 feet of the building. Well, there are a couple of exemptions in state law for smoking. One, obviously, your own home. Two, tobacco warehouses, tobacco stores. If you're an employee-owned bar where all the employees are smokers, you can smoke. And the fourth exemption for nursing homes. That really shows that, first of all, skilled nursing facilities aren't institutions. They are people's homes. And you should be allowed to smoke in your own home. So there was a bill introduced a couple of years ago that would have eliminated that exemption for nursing home residents. We all know the dangers of smoking. We know smoking is not good for you. We know the health risks associated with smoking. And I'm not an advocate for the tobacco industry, but I am an advocate for residents' rights. And residents have the right to be involved in activities and recreation that are meaningful to them. If you ever go to a nursing home, look for the smoking section. You're going to find some diehard people out there who are enjoying this one last bit of freedom that they have. You know, they've lost the ability to drive. They've lost the ability to live independently. They may have lost spouses. They may have lost other family members. They've lost the ability to care for themselves. They have little control over their lives. And this is one pleasure that they want to participate in. As ombudsman, we don't advocate necessarily what's in the best interest of the resident, but rather the expressed wish of the resident. So I had to testify in these hearings, you know, going up against the American Heart Association, the American Lung Association, California Department of Public Health, to say, we're not advocating for people to smoke, we're advocating for their right to smoke. So, you know, our Health and Human Services Agency, the umbrella agency in which the Department of Public Health and my office sit, said, Public Health, Ombudsman, come together, talk, let's find a solution that we can present to the governor. We talked, I stood my ground, they stood their ground. At the end of the day, the governor vetoed the bill and said, these are residents' homes. They have a right to do what they want in their own homes. The governor got it. We ensure effective program administration by making sure that all of our ombudsman representatives are trained using consistent core curriculum that's been developed by the state. We ask all ombudsman representatives to adhere to the code of conduct that's been established by the National Association of State Ombudsman Programs. We rely on the local ombudsman programs in the area of agencies on aging to ensure that there are effective personnel management policies in place and financial management policies in place. We have a state-developed ombudsman data integration network, or ODIN, that collects all of the complaint data and other activity data that our programs are involved in. And we go out to monitor these programs on a regular basis to ensure that they're in legal and regulatory compliance with both state and federal law, and help them with their own long-range planning for their agencies. As I mentioned, you know, quite a few of our representatives are volunteers. This is actually the most accurate information as of the end of federal fiscal year 14. 790 out of our 894 representatives were volunteers. We look at continuous ways to make the program more efficient. We have very limited resources from both the federal government and the state, and so, you know, we're operating this program on about $8 million a year to go into 1,300 nursing homes and 7,600 assisted living facilities. You know, that's not a lot of money on which to top of this program. But when we look at the amount of advocacy and community service provided by investing in the ombudsman program, the state's getting a fantastic deal here. During federal fiscal year 14, we received and investigated more than 39,000 complaints. We resolved or partially resolved satisfaction of the resident. 73%, I think I said 76 earlier, but 73% of the complaints that we received. Responded to about 8,100 complaints specifically involving abuse and or neglect. And we witnessed advanced healthcare directives and other witnessing needs of residents. We visited about a little over 3,300 facilities on a quarterly basis, not in response to a complaint. We conducted about 4,000 hours of training for long-term care ombudsman representatives. In addition to the 36 hours of basic training that they get, they also have to complete a minimum of 12 hours of continuing education each year to maintain their certification. We did about 440 training sessions to facility staff, and a little over 12,000 consultations to facility staff. These weren't complaints, but questions or concerns that the facility had in long-term care facilities. Questions?
So is it illegal or legal for a resident to smoke in their home?
It's legal for a resident to smoke in the facility.
Okay.
what many facilities have done, because as the ombudsman, we have to make sure that the rights of the smokers and the non-smokers are protected. So historically, facilities have had either a smoking room or lounge, but sometimes that's not really good because of the smoke. If there's not good filtration in the system of the facility, that smoke can get out to other parts of the facility. So some facilities will have an outdoor area where residents can congregate with supervision from staff and smoke there, and that's acceptable as well.
Okay.
How come it's such a limited resources to run those programs? It seems like they're very important, and if you so heavily rely on volunteers, I think nursing homes won't be taking them as seriously, at least that's my view. Is there any way to increase that ratio?
Well, we've tried. The Institute of Medicine, which is, I think their tagline is the nation's advisor on health, did a study on the long-term care ombudsman program as a public health program, and their recommendation was that there should be one full-time paid ombudsman for every 2,000 long-term care beds in a planning and service area. Here in California, we're at about 1 to 2,800. So we're below the staffing, the recommended staffing ratio. And some of that is because of funding cuts that the program has received over the years. Back in 2008, Governor Schwarzenegger eliminated all state general fund support for the program, about $3.8 million. Almost half of our entire budget was eliminated overnight. And so at the time we had about 183 paid staff. We lost 76 of those positions. That had a ripple effect because if you don't have staff, you don't have people to recruit, train, supervise volunteers. So not only did we start to lose staff, but we also lost volunteers. So over the years, there have been efforts to restore that funding, and there have been incremental increases. The most recent being this past June, when the governor signed the budget and gave us an additional $2.4 million in various funding sources. The state had control over some general fund money, some money from a penalties account where the Department of Public Health cites facilities if they violate state nursing home laws. We get a portion of those dollars, and they also increased the licensing fee that facilities have to pay to public health to license their facilities. There's an ongoing fee for the facility, but then there's also a per bed licensing fee. So they increased that fee by $3.37. That raised almost $500,000 for us. The program was designed to be a volunteer program by Dr. Fleming in Congress. It wasn't meant to be a regulatory or enforcement program. We were envisioned to be a problem solver. So many times we've got to use those skills of mediation, cajoling, knowing what the law says and pointing out to facilities what the law says. Sometimes it requires a cross-report to licensing, them to come in and say to the facility, yeah, the ombudsman's right, you need to do this, and if you don't, we're going to cite you. So somebody once said the only power that an ombudsman has is the power of persuasion and encouraging facilities to do the right thing by residents. So I don't see the model really changing in terms of getting more paid staff. Certainly for the more complex cases like the abuse investigations, you want maybe those to be handled by paid staff, because volunteers do things like go on vacation and only want to work a certain number of hours per month. The paid staff who are going to be there, and are going to be there Monday to Friday, and the abuse cases are going to take more time, you can delegate those responsibilities to the paid staff who are going to be around and give the other types of complaints to the volunteers that might not be as time sensitive or as time demanding. Other questions?
your volunteers mostly older people? Or?
They are. They are. Most of them are retired. They come from all different walks of life. We've got retired social workers, nurses, teachers, physicians, homemakers, people, who come to this from, a career in biochemistry and want nothing to do with it anymore and want to do something like this. So they really do come to us from all different walks of life. Yeah.
Are volunteering, if they wanted to experience what a regional or local ombudsman does, how would they go on like a ride along
Sure.
and getting into the field?
Sure. Many programs, before putting people through the certification training, because that's a real time commitment for folks, will have like an orientation to the ombudsman program, and may take you out to the facility to show you what an ombudsman does. Sometimes people have a perception that we're like a friendly visiting program, that we just, we're at the Sunshine Club and try and visit residents, bring a little joy to them. Well, it is about visiting residents, but it's not necessarily to be a social activity. We're there to check on their health, safety, and welfare. And sometimes that puts us in a position of being assertive with facility staff about residents' rights. It puts us in sometimes an adversarial position with facilities, and sometimes that's not a position that people feel comfortable taking on. So we want people to know up front what you're going to be involved in as an ombudsman. It's not a warm, fuzzy volunteer experience necessarily. You're going to be dealing with some pretty gruesome things. You're going to be dealing with abuse, neglect, stage 3, stage 4 pressure ulcers where you can see right through to the bone, where people obviously have been neglected. So, this isn't an experience that everyone wants to have, or that they feel they have the skills to do. But if people are passionate about justice, they're passionate about righting wrongs, this could be a great volunteer opportunity for someone. Other questions? Okay, we've got a few more minutes, and I know you want to be talking about job opportunities,
Yes.
not volunteer opportunities, job opportunities. Okay, you're here getting your majors, your minors, and GERO. What can you do with this for the state? Well, a lot. The state needs people trained in gerontology to be those surveyors that go out to the facilities to conduct the inspections. Department of Social Services just got a ton of new money to hire what we call licensing program analysts. These are people who go out to the assisted living and board and care facilities to do the inspections. Up until this year, licensing social services only went out to facilities once every 5 years to do an inspection. Now they're being phased in to eventually do annual inspections. So they are in hiring mode and need people trained in gerontology. Department of Public Health also just got a ton of money to increase the number of inspectors that they have. They have a backlog of complaints. They're dealing with 11,000 complaints that are backlogged. It's going to take them 4 years to get through this backlog of complaints. So they're hiring. For those positions, you would probably need a little bit more than your degree in Gero. They look for RNs and registered dietitians to be those surveyors that go to the nursing homes. Department of Aging. We have a special classification in state service called Aging Programs Analyst. And these are people who do analytical work. They're the ones who do the bill analyses. They're the ones who provide the technical assistance to the AAAs and the local programs. And one of the requirements to be an aging programs analyst is to have a degree in gerontology. So with that degree and with some experience, you can qualify to become an aging programs analyst with the Department of Aging. These are great jobs. great salaries, great benefits, stability with the state. It's something that I would hope each one of you would consider if you're thinking about going into that kind of administrative work with your GERO degree. It's not hands-on work. You don't see a lot of seniors. You don't touch a senior every day, but yet the work that you're doing does a lot to protect and improve the quality of life for seniors in facilities and in the homes. And we're always hiring. The Aging Programs Analyst exam is done on a continuous basis. So as soon as we go through that list and hire people off that list, we give the exam again. So it's something I hope you would consider for your potential career. These positions pay pretty well. The Aging Programs Analyst and these licensing program analyst positions run between around I think $50,000 to $65,000 a year. There's of course employee health, medical, retirement. We have a defined benefit contribution retirement plan, so the state takes care of you if you take care of the state. If you commit to working for the state for your career, at the end of your career, you'll be able to retire with some good benefits. It's important, I think, when you're applying for state jobs to make sure you talk about all of your experiences in working in and with seniors and with senior programs. Make sure you cover any volunteer time, any intern time, because that can be counted toward your years of experience. I know for the Aging Programs Analyst position, we want that degree, but we also want to see at least 3 years of experience working in senior programs. So if you can include in that 3 years, the 1 year that you worked at an assisted living facility, or the summer that you spent at the Alzheimer's Cafe, all of that stuff counts, and don't downplay it. Make sure you include that in your application, because it does count. You might not have been paid for it, but you can certainly count it as experience.
And is the application process, everything still online where you?
Yep, everything's still online. If you go to our website, aging.ca.gov, there's a link on our homepage for employment opportunities, career opportunities with aging. Check that out. You can also go to the state HR website. I think it's calhr.gov. And if you type in positions like licensing program analyst, it'll take you to any exams that are open. And again, I think if you're near graduation or thinking about this as a possible career for you after graduation, see if you can get on that list, take that test. It could be advantageous to you to do that now, sooner rather than later, because as I said, they are in hiring mode, and they obviously can't hire 200 people overnight, so they're doing it in phases. And you might not be phase 1 or 2, but you could be in phase 3 or 4 of their recruitment. It's going to be done over several years. So don't give up hope if you don't get in on the first go around. They're going to be hiring for the next at least 4 to 5 years.
So the process is usually then you go online, you apply, you schedule for an exam, and I mean it's not uncommon. Sometimes you don't hear for months.
Yeah.
But then they usually keep your information in the system. So.
Yeah. And the exam isn't necessarily like multiple choice kind of exam. It's usually an interview with a board, a panel that will ask you a series of questions about being an analyst, or your experience with nursing homes, or your experience with assisted living, or your experience writing reports or collecting information, conducting investigations. They want to look at your analytical skills, your ability to problem solve, your ability to identify problems and offer recommendations to correct those problems.
Do you need your degree at the time you're applying for that application?
Not necessarily. If you're applying now, you could put on there, they're going to ask you for your educational background, and you can put on there, your expected date of graduation and your degree. So if you know you're going to graduate in May, you can say, May 2016 or December 2015, that should be fine. They may ask you to provide later, a copy of your diploma or your transcript, but, that shouldn't be a problem. Other questions about hiring state labor opportunities?
I'm just curious, I want to work in assisted living, like personal care assistant. When you get your gerontology degree, do they have to pay you at a certain rate? Or when I worked at one, I was only paid like minimum wage because I didn't have a degree. But when you get your degree, does that?
It should help. It should help. You're working basically in the private sector, so there aren't going to be necessarily minimum base salaries. A lot of that will be negotiable depending on the structure of the facility. Are they part of a large chain? Is it a standalone facility? So there's some room for negotiation. For some of the larger facilities, they will have a certain salary range in which they will pay if you have certain qualifications and experience. The other thing to consider too is some of you might have the degree but not all of the experience. Oftentimes people really might want that analyst position, but you might not meet the eligibility for the test, but they might meet the eligibility for another position, maybe below an aging programs analyst. They may meet the qualifications for a staff services analyst. It's okay to apply for those too, because that gets your foot in the door. It gives you some additional experience working with the program that you can later use to reapply for the aging programs analyst position. So I've had people, who started as an office assistant or an office technician, basically a clerical worker, who have had master's degrees, and they got their years of experience and got to learn the program and were able to test and take other positions. So I've got one person on my staff right now who started off as an office assistant, and now she's an aging programs analyst after 5 or 6 years on the job. She's learned the program, and she's good at what she does. I've got another person on staff who's a graduate of the Gero program here, and she's one of our shining stars in the department, and it's definitely moving places and moving her way up into management, I think. So there are lots of opportunities. Sometimes you can't get that dream job on your first go around, but you can at least get your foot in the door, make yourself known, let your supervisors see the kind of work that you do, the kind of person you are, and you're going to stand out in that person's mind when it comes to promotion opportunities. They're going to see you, they're going to know, well, you'll be a known quantity. You're going to be somebody that they know, they trust, that they want to help succeed and move up the line. So, if you don't qualify right away for some of those analyst positions, think about some other opportunities that will at least get you in the door and get you known to one another. Your internships help as well too. Make use of those when you're applying for jobs. Make it known that you've spent X amount of time at a particular site or facility, and these are the kinds of things you were involved in doing. The state is really looking for people with analytical skills, the ability to problem solve. So, if you were in Juro 102, remember the bill analysis online exam or online assignment we had? That's going to be a critical function for a lot of these analytical positions, knowing how to do a bill analysis and knowing how to look at the bill and weigh the pros and cons of what this bill will do or won't do on behalf of residents or the affected population. Any other questions about state jobs? If at any time you see a state job that you're thinking about applying and you're barking up the resume and your application, maybe offer you some tips on how to fine tune it for this particular position. Okay? I see a lot of applications. I hire people, fortunately not that often, because the people I have tend to stay, which is good. But you know, I can tell you as an employer, you know, the applications that are going to pique my interest and the applications that are going to go in the garbage. So know that I'm a resource for you. Okay? Anything else?
Thank you.